Everybody, today is my first day at my new job. It's time to get ready. Hey guys, hey, it's been a while. I know I've been slipping, y'all. I had so much going on, it's not even funny. So I am currently heading to my first day of work at urgent care in the Bronx. I'll be on a 3-week Locum Tenen assignment, and basically the physician assistant that works there now, he only works there part-time and is unable to transition to full-time until 3 weeks. So in the meantime, I'm going to be taking over for 3 weeks full-time until he fully transitions to a full-time position in the clinic that I'm in now. So yesterday I had went in on my own leisure time to learn the EMR system, so that I can start today fresh, with no problem. So yes, I learned the EMR system. The EMR system is pretty easy. It's actually not really bad at all. So I learned that yesterday. Today I'll be there by myself. I'm the sole provider there. There are, from what I was informed, there are three medical assistants, the front desk, patient care tech. There's 2 of them, I believe, and the supervisor who hired me actually works in that clinic, does administrative works in that clinic. So they told me it's super supportive. I don't have to worry about anything. There's an MD on call if I need it. My only thing is I'm nervous because I went in early, and usually, like, I'm the type of person that would just learn the EMR system the same day, usually in the morning time. I remember when I worked in a position in Jersey, I learned the EMR system in 30 minutes with another provider before I started. But being that I've been out of, like, the clinical setting for like 8 months, I've been working remotely. I do work remote as a Locum Tenens as well. I've been working there since November, about doing a little COVID crisis contracts and stuff like that in other states. But I haven't stepped foot in a clinic in 8 months, so I'm a little nervous, like, about basic skills, like listening to the lungs, or like checking the ears, and making sure I'm not missing otitis media or something like that. So Dunkin' Donuts in the morning, so I'm gonna go grab one of that, and I'll meet you guys in the clinic. Okay, y'all, so I just made it to the clinic. The clinic isn't open, and then so I have patients that are waiting outside, but I can't do anything about it until the clinic is open. The good part about it is that about here is that there is parking, okay, reserved parking for employees, so it didn't take me long to get here. All right, y'all, the clinic just opened, so I'm about to head inside now. Okay, you guys, so I'm gonna take you guys through a day with me inside the urgent care. So first and foremost, there's certain like stuff that I like to keep next to me when I'm in the office. So I'll show you guys now. So besides this antibiotic guide, which you can get off of Amazon, it has like all of the like urgent care kind of issues that are in here. You can use it in any setting, but a lot of these are what we see in urgent care. I like to keep near me my ceftriaxone, ketorolac for any of my pain patients, and azithromycin for my chlamydias, ceftriaxone I said already for my gonorrhea patients, aspirin for my chest pains, and that's pretty much the main thing. Actually, tetanus shot for anybody that had like any bites, cat bites, dog bites, and like anybody that don't know when they got their tetanus shot but got like bitten by something. So I like to keep those around me as well. So the biggest thing about urgent care really is pretty much assessing like the reason why they came in, and evaluating the reason why they came in. Obviously looking for abnormal vital signs, which is done by the medical assistants, but making sure that you address the chief complaint and you resolve the chief complaint and provide any education and follow-up. So I like to keep my pediatric drug guide. This one isn't mine, but I have one of my own for the peds patients, especially in urgent care, common use meds in the urgent care. And obviously the dosing chart, especially because mainly in the urgent care we give a lot of ibuprofen, Tylenol for our younger kids. And so I do have a scribe here that pretty much is supposed to walk in the room with me and just take like basically document for me, that can send medications for me. But since COVID, the scribes has just been doing the COVID testing, documentation, and then at the end of the day I will sign off on those, and I have been just pretty much seeing those who didn't come in with COVID. So that's our back pains, our cough, STDs, suturing. So those kind of patients are the ones that I see, and I document my own note on them, while the scribe documents all of the COVID. But prior to COVID, the scribe will walk with you in every room and pretty much document and send meds, and whatever you need the scribe to do, they'll do as well. So the first case I have today is a back pain. From looking at the documentation, there's no history of back pain. So what I'm gonna go do is just find out like the reason for her back pain, any interventions she probably done, did it help, what aggravates it, what makes it better, and then we'll work our way from there. See you guys soon. So she said she had back pain for about a week. She does work in the hospital. She lifts patients. So back pain for a week. She said she tried Tylenol. She said she tried ibuprofen. None of which really helped. Her pain came back. So pretty much I told her that back pain is pretty common, especially in her line of work. I made sure she didn't have any like liver issues, any kidney issues, and offer her a ketorolac injection for her back pain, which she was agreeable to. And then I prescribed her, because she only brought over the counter ibuprofen and Tylenol. So I prescribed her 800 milligrams of ibuprofen to take every 8 hours. I told her if she's still experiencing pain, to take the next dose pretty much 8 hours from the time that I gave the ketorolac, and just see how her pain is from there. We spoke about back techniques and things like that, how to like position yourself when repositioning patients, and she was pretty satisfied with her visit. Hopefully she doesn't have to come back for any reason. So right now, even though we have like an x-ray machine, it wouldn't be ideal to just go ahead and get an x-ray. Just try to manage the pain first. She doesn't have any history of back pain, so it's most likely related to her job occupation. And maybe she had a heavy patient, this week. So yeah, so we just treated her with ketorolac. One case was a baby who came in with stuffy nose. I did my examination. He had a stuffy nose since Friday, had fevers times 2 days, hasn't been sleeping as well, eating and drinking, hasn't been eating as well, urinating and all of that stuff is okay. But so on examination, I noticed that, she does have a stuffy nose, which is okay. Kids have a stuffy nose, but her lung sounds was chunky. And so I advised the parents to go to the emergency room, because she might need like some type of respiratory treatment, because she's really junky. She was really junky. Her oxygen was fine here, but I suggest that they went to the respiratory room. The emergency room. So guys, I've been pretty much busy with a lot of things. Like, I have 3 physicals coming up right now, so I'm gonna look through them right now, and I have a couple more other patients that need to be seen. So I gotta bust down these physicals real quick, but I'm gonna show you what a physical is about. So I'm about to go see a physical. These are our normal physicals. Most cases require drug screening, rubella, rubeola, mumps, titers. We vaccinate if their titers are low, and just tuberculosis as well. So I'm about to go see one of those right now. Okay guys, so I got a little busy. I had 3 physicals back to back, but I'm gonna complete them now. Physicals. So most of our physicals are school physicals and pre-employment physicals. We don't do like pediatric physicals and urgent care. That should be done by the pediatrician, but we do a lot of employment physicals, and it usually requires an MMR, quantiferon, and drug screen. I do the physical part, and then when the results come back, I see and I clear them for work or school, for colleges and stuff like that, those kind of physicals. So yeah, I had 3 back to back. It's been a busy day so far. So I'm gonna fill it out, and then I'm gonna document that the physicals are completed and just needs evaluation further pending tests test results as to whether they're cleared or not for work. So you guys, I'm going to follow up with you guys at the end of the day because it's a busy day. Let you know how my day went, any cool cases or anything like that. But for now, stay tuned. Yesterday I was unable to speak to you guys about how my day went, like just a brief reflection of how my 12-hour shift went in urgent care first day. I was unable to speak to you guys about it, but it was crazy. It was a crazy like first day. I had a lot of physicals, just a lot of physicals from agencies. I had a fair amount. I don't know, everybody came in yesterday with like some type of GI pain and some type of cold. A lot more of the PCR testing, which I don't handle, by the way, my scribe does. But it was just overwhelming. I didn't finish my notes. I had like 4 notes yesterday left. Easy notes. I was just finishing up like the plan of care or whatever. But yeah, I had one person that came in very last minute, and it kind of delayed me from finishing my stuff. So I'm heading to the office a little bit early this morning so that I can finish my notes before the start of the day. I hope you guys enjoy just a day run throughout what I see in the urgent care, what I do in the urgent care, what I do as a Locum Tenen provider. I just got my California license fully to practice in the state of California as a nurse practitioner. I'm actually looking to go to California, so I just been pretty much looking for positions out there, and after this contract, or I might take a break because I do have a few trips planned out before going into this next contract. So, but I'm super happy because I'm officially, after a long, boring, almost 6 to 9 months, I think, I am now licensed to practice in California. So I'm gonna start looking for some Locum Tenens opportunities in California.